Antibiotics for the Nclex. As usual, we're going to start with a quiz. The nurse is caring for a client who is receiving tobramycin sulfate IV every 8 hours, which result should indicate to the nurse that the client is experiencing an adverse effect of the medication. 1, a total bilirubin of 0.5 milligram per dl. Again, we need to know, you need to memorize your lab values. So I know that the normal bilirubin, total bilirubin level ranges from 0.3 to 1.0 milligram per dl. So again, I'm not going to be concerned with this, so I can eliminate this. So I won't be, this doesn't tell me the client is experiencing an adverse effect. It's within normal range. 2, an erythrocyte sedimentation rate of 15 mm per hour. I know that the normal sedimentation rate for male is less than 15 mm per hour, and for females is less than 20. So this is within range. So I'm also going to eliminate this. Number 3, a BUN level of 30 milligram per dl. I know that my normal BUN level should be between 10 to 20 milligram per dl. So this is elevated. And I know that tobramycin is an aminoglycoside antibiotic. And some of the adverse effects you will see with aminoglycosides include nephrotoxicity, which is what is showing us on the BUN. So it's having an effect on the kidneys. So you will see an increased BUN, you will see increased serum creatinine. There could also be irreversible ototoxicity. And what you see in a client that has ototoxicity, there's going to be tinnitus, there's going to be dizziness, ringing or roaring in the ears, and reduced hearing. There could also be neurotoxicity. And with neurotoxicity, you see headaches in the client, there's dizziness, there's lethargy, there's tremors, and visual disturbances. So I'm going to hold on to 3 while I look at the last option, a WBC count of 6,000. Well, I know that the normal level should be between 5,000 to 10,000 millimeter cubed. So this is within range. So I'm going to also eliminate this. So you want to remember that aminoglycoside antibiotics are potentially nephrotoxic substances. And what are examples of your aminoglycosides? Your gentamicin, neomycin, streptomycin, tobramycin. So you notice we're almost sounding like mice. So that's one way to remember it, mice. So that's why I have this picture of a mice with a very big ears. So you can see the big ears. So we want to remember mice with a big ears. And what does a big ear signify? That it could cause ototoxicity. And again, if you look at the big stomach, that could also tell you it could affect the kidneys in the mice. So that's one way to remember it. Remember the mice with the big ears and the big stomach, and the big ears, mycin, mice. It can affect the ears, the ototoxicity, and again, the nephrotoxicity. So with antibiotics, we know they are used for treatment or prophylactic measure for various bacterial infections. So what are your considerations? We want to obtain specimen prior to beginning treatment. So we want to take samples for culture and sensitivity before we begin treatment. You also want to look out for allergies. Look at past medical history. There could also be cross-sensitivity among related chemical agents. So you need to know history of any hypersensitivity. So you need to know history of any hypersensitivity. You also need to look out for the risks of superinfection. And this is most likely with broad spectrum antibiotic treatments. So you want to look out for superinfection. Again, there could be organ toxicity. The liver and the kidneys are involved in medication, metabolism, and excretion. And antibiotics have greater propensity to be damaging to the kidneys or to the liver or to both organs. So you want to look at past medical history, especially if the client is on a potentially nephrotoxic medication. And in terms of teaching, you want to teach the client to take as prescribed. He needs to maintain the timing, to maintain the blood therapeutic levels, and he has to take the full course of therapy, even if symptoms are relieved, because you don't want to have resistance to the antibiotics. You want to encourage your clients to take fluids. You want them to check expiry dates on the drugs they are taking. And again, you also want to educate this client to let them know that antibiotics can decrease effectiveness of birth control pills. I repeat, antibiotics can decrease effectiveness of birth control pills. So they must use reliable backup methods. So let's look at the different families of antibiotics. And we're going to start with the aminoglycoside. And one example, we have some examples of them. So you can see, remember we talked about the mice. So you can see your neomycin, your streptomycin, your gentamicin, your tobramycin. So remember the mice with the large ears and the big stomach. Large ears remind you that it could be ototoxic to the ears, and also the big tummy tells you it could be nephrotoxic to the kidneys. We know that the aminoglycosides work by inhibiting protein synthesis in gram-negative bacteria. Where could we use aminoglycosides? We can use them for severe systemic infections, Pseudomonas, E. coli, or proteus infections that affect the CNS, the respiratory tract, the GI tract, the urinary tract, bone, skin, and soft tissues, or even acute pelvic inflammatory disease. Most especially, streptomycin is used as part treatment for tuberculosis. So you need to remember that. We mentioned the side effect again. We said ototoxicity was one, nephrotoxicity. You can also have anorexia. You could have nausea, vomiting, and diarrhea. What's your nursing consideration for our aminoglycosides? You want to check the 8th cranial nerve. You want to check the 8th cranial nerve for this client. Remember, we said it could be ototoxic to the ears. So you want to assess the 8th cranial nerve. And we can do that using a tuning fork, or your Weber, or your Rhine test, or your Whisper test. Again, you could also talk to family or caregivers to get information if they've noticed anything with the client's hearing. Because it could also be nephrotoxic, you want to check renal function, most especially your BUN and your creatinine. Encourage the clients to take fluids, and with IV gentamicin, so that's your gentamicin there, with IV gentamicin, you want to assess peak and trough levels. Remember that peak level is drawn 45 to 60 minutes after administration of the antibiotics. So peak levels is drawn 45 to 60 minutes after administration of antibiotics, while trough is drawn immediately prior to the next dose. So you're able to monitor therapeutic level and know if drug in your client is too high and could be causing oto or nephrotoxicity. So again, peak is drawn 45 to 60 minutes after administration of the antibiotics, while trough is drawn immediately prior to the next dose, because you want to monitor therapeutic levels. Another class or family of antibiotics will be your cephalosporins. And you will notice some of the examples we have. You have the Kef Cefaclor, cefazolin, cefalexin, ceftriaxone, cefoxetine. So you can see the cef. That's one way to remember this particular class of drug. The cephalosporins, they start with cef, the prefix cef. And it is bactericidal, meaning it inhibits bacterial cell wall synthesis. They are very active in disease conditions like tonsillitis, otitis media. Could also use them as preoperative prophylaxis. We can use them for meningitis, dermatologic infections, gonorrhea, and UTIs. Some of the side effects you must be familiar with in terms of your cef or your cephalosporins is they could cause GI disturbances such as nausea, vomiting, and diarrhea. So you want to tell the client that they should take the drugs with food to reduce these GI disturbances. Clients should also avoid alcohol because they can experience some uncomfortable systemic symptoms such as flushing, dizziness, headache, nausea, vomiting, and muscle cramps. So they need to avoid alcohol. They also need to look out for cross allergy with penicillins because they both share similar molecular structure. So again, with your cephalosporins, you want to remember that they have the prefix cef, and some of the side effects include they increase bleeding time, they could cause a rash, they could cause super infection, and again, the GI disturbances we talked about. And in terms of your considerations, they need to take with food to reduce GI disturbance. They should avoid alcohol because of that uncomfortable systemic symptoms. And again, they need to be observant to cross allergy when used with penicillins. The next class we'll look at is your fluoroquinolones. This interferes with DNA replication in gram-negative bacteria. What are examples of your fluoroquinolones? There's your ciprofloxacin. There's your levofloxacin. There's also your moxifloxacin. And if you notice, they all end in similar suffix, floxacin. So that's one way to remember your fluoroquinolones. They end with floxacin. We'll use these drugs, this family of drugs for E. coli, for Pseudomonas, for Staph aureus, especially infections with the bone and joints, bronchitis, pneumonia, gastroenteritis, acute sinusitis, prostatitis. And some of the side effects you must be aware of include they can cause decreased WBC and HCT levels. They could also cause elevated liver enzymes. They could also cause elevated alkaline phosphatase levels. And one important one is the Achilles tendon rupture. You would always notice this when you use levoflox with a steroid. So you want to look out for that. If you use a fluoroquinolone like levoflox with a steroid, the client could actually have this side effect, which is your Achilles tendon rupture. There could also be headache, rash, and the client could also suffer photosensitivity, and there could also be a potential for seizures. So our priority side effects would be decreased WBC and HCT, which will keep the client prone to infection, elevated liver enzymes, your Achilles tendon rupture when you use levoflox with a steroid, and again, the potential for seizures. So part of your nursing consideration would include encouraging fluids. So you want to give the drug with a full glass of water, and the client can take the drug 1 hour before meals or 2 hours after meals. With levofloxacin, they can take 2 hours before or 2 hours after they are taking an antacids or any iron-containing products. So it needs to be spaced apart. Again, you also need to monitor the client's theophylline levels and also their glucose levels. Why do we need to monitor those? Because levoflox or levofloxacin can increase theophylline levels. We know that levels greater than 20 microgram per mil of theophylline is considered toxic. So we need to watch out for that. If your client is on levoflox, you need to make sure the theophylline levels don't go above 20 microgram per mil, because it could, the client could become toxic. Again, with your glucose levels, if the client is taking a fluoroquinolone and is also taking an oral hypoglycemic for diabetes, we need to monitor their glucose levels, because we know that a drug like levofloxacin can increase the effects of the oral hypoglycemic, and it will cause the patient to be what? Hypoglycemic. So you want to monitor the client's glucose level, you want to monitor the client's theophylline levels. With macrolides, this is another class of, another family of antibiotics. You'll see drugs such as erythromycin. So you can see thromycin here. And again, we also see azithromycin here. So that's one way to know your macrolides. Thromycin, they end with thromycin. And we know that these drugs bind to cell membrane and they change protein function. They are bacteriostatic as well as bactericidal. So we use them for acute infections like your RTIs, your sinusitis, soft tissue infection, as well as STIs, acne. We can also use them as prophylaxis before dental procedures if the client is allergic to penicillins. So what are the side effects we should know about our macrolides like your erythromycin or azithromycin? You want to look out for diarrhea and abdominal cramping in your clients. This drug could cause nausea and vomiting. It could also cause confusion and uncontrollable emotions. Macrolides are potentially hepatotoxic, and there's also risk for super infection. So you want to look out for that. Again, you're looking out for confusion and uncontrollable emotions. You know that they're hepatotoxic to the liver, and there's also risks for super infection. In terms of our nursing consideration, you want to educate the client to take this medication 1 hour before meals or 2 to 3 hours after meals. Monitor liver function because of that hepatotoxicity we mentioned. Again, there could be some medication interactions with these drugs. We know that macrolides can also increase serum levels of theophylline. They can also increase serum levels of carbamazepine, and they could also increase serum levels of warfarin. So you need to know that. Again, with erythromycin, if the client is taking verapamil or antifungals like your fluconazole, these medications would increase the concentration of the erythromycin, and this could lead to cardiac death. So you need to be conscious of that, particularly with erythromycin. So if your client is on erythromycin and is taking verapamil or taking an antifungal like your fluconazole, you need to watch your clients because these medications can increase the concentration of our erythromycin, and this could cause or lead to cardiac death. With penicillins, what are examples of penicillins? You will notice that all of them end with cilin. So we have ampicillin, we have amoxicillin, although there's also augmentin, which is a makeup of amoxicillin and clavulanate acid. So that will be your augmentin. So these drugs inhibit synthesis of cell wall, meaning they are bactericidal. They are used for moderate to severe infections of the respiratory tract, the sinuses, the urinary tract, the skin and soft tissue, otitis media, gonorrhea, syphilis, and also for Lyme disease. What will be Lyme disease again? Lyme disease is that tick-borne illness that's caused by the bacterium Borrelia burgdorferi. And we know that deer ticks that are on deer, can carry the bacteria that causes this Lyme disease. And what you see in your clients, usually you see this bull's eye pattern rash and flu-like symptoms. You also see joint pain and weakness in the limbs. So again, for your Lyme disease, you see the bull's eye pattern rash, you see flu-like symptoms, and then there's joint pain and weakness. So back to our penicillins, what are the side effects you will see when you use this drug? There could be superinfection, there could be GI distress, there could also be allergic reactions. So again, remember with your superinfections, you could see stomatitis or vaginitis. We could also see GI distress, like your nausea, your vomiting and diarrhea. And then there's the allergic reaction. And also we could see renal and hepatic changes. In terms of our nursing consideration, you want to check for hypersensitivity with penicillin. Remember that 5 to 10% of clients will experience an allergic reaction. Maybe not with the first dose, but however, if it's the first time the client is receiving penicillin and you are giving IM, you need to monitor for at least 20 minutes for presence of allergic reaction. So you don't want to give your client and let him go. You want to monitor for 20 minutes for presence of allergic reaction. The client can take the medications 1 to 2 hours before meals or 2 to 3 hours after meals. Like we said with the cephalosporin, you want to watch out for cross allergy with penicillin. So penicillins, cephalosporins, watch out for cross allergy. Again, remember your cephalosporins, we said they start with Kef. So you have your Kefaclor, we have your Kefazoline, you have your Kefalexin, you have your Ceftriaxone, and all of that. You always remember with the prefix Kef. Also with our sulfonamides, this is another class of antibiotics. And what examples do we have with this? There is the sulfosalazine. So you can see most of these drugs, your sulfonamides, they begin with sulfur. Again, you can also see another sulfur methoxazole. So it also starts with sulfur. So that's one way to remember your sulfonamides. So you want to know these drugs by their classes. So sulfonamides, they start with sulfur. And again, these drugs are bacteriostatic. They interfere with cellular metabolism and growth within the cells, leading to cell death. And we use them in ulcerative colitis. What's your ulcerative colitis again? It's a long-term condition where the colon and the rectum becomes inflamed. We also use it in Crohn's disease, which is that chronic inflammatory bowel disease that affects the lining of the digestive tract. We could also use it in otitis media. Remember, otitis media is that infection of the air-filled space behind the eardrum, the middle ear. So we can use it with otitis media, we can use it with UTIs, respiratory tract infections, prostatitis, your MRSA, conjunctivitis, meningitis, and toxoplasmosis. What's your toxoplasmosis again? This results from infection with a common parasite that is found in cat feces and contaminated food. So again, you want to always link toxoplasmosis with your cat feces or your cat stool. So what are the side effects? You can have crystallization of this drug in the urine, or what we refer to as crystalluria. There could also be photosensitivity. You could also see GI upsets. There could be stomatitis, which is that inflammation or sores inside the mouth. There could be hypersensitivity with sulfonamides. That will be that rash or severe skin eruption or reaction. Sometimes it's referred to as erythema multiforme, which is actually a variant. And it can also lead to the development of Stevens-Johnson syndrome. Here you see severe exfoliative dermatitis in the clients. So you want to look out for that with your sulfonamides. And there could also be bone marrow depression. In terms of our nursing consideration, the client should take the medication 1 hour before meals or 2 hours after meals. Encourage fluids. Take with full glass of water to prevent that crystal urea we talked about. So you want them to take with full glass of water. Provide good mouth care. Remember, we talked about stomatitis. So you want to provide good mouth care because of that risk of stomatitis. And then there could be interactions with your sulfonylureas and your warfarin. Remember, if the client is taking oral hypoglycemic, that is a sulfonylurea, they could experience an increased hypoglycemic effect. What are your sulfonylureas? Your glipizide, your glyburide, your glimepiride. So those are your sulfonylureas. So if the client is taking oral hypoglycemic, that is a sulfonylurea, in addition to your sulfonamides, they could experience increased hypoglycemic effect. So you want to look out for that. Also, if the client is taking warfarin, they could also experience an increased anticoagulant effect. You also want to look out for that. And with your tetracyclines, these are your doxycycline. So you can see cycline, your tetracycline, you can also see cycline there, and your minocycline. You can see how all of them end with the suffix cycline. They are also bacteriostatic. They are used for infections like your chlamydia, gonorrhea, syphilis. It can also be used with metronidazole to treat your H. pylori infection. We can also use tetracyclines for your acne vulgaris, which is that skin condition that occurs when hair follicles plug with oil and dead skin cells. We could also use them, use tetracyclines for Lyme disease. Remember, with Lyme disease, we talked about a tick-borne illness that is caused by a bacterium, and that we said the dead ticks can carry the bacteria that cause this Lyme disease. So the D-E-E-R, DERs can carry these ticks that can cause this bacteria, and you will see this bull's eye pattern rash and flu-like symptoms in addition to joint pain and weakness of the limb in this client who has Lyme's disease. So we use it to treat Lyme's disease. In terms of side effects, you could see discoloration of the primary teeth if this drug is taken during pregnancy. We could also see glossitis, which is that inflammation of the tongue. So you want to be conscious of this with your tetracycline. With glossitis, if the tongues become inflamed, it can cause the tongue to swell in size, change in color, and develop a different appearance on the surface. So you want to be concerned about your patient's airway having a side effect to tetracycline. There could also be this rash and severe photosensitivity. So they could have this severe photosensitivity. In terms of your nursing consideration, the client could take this drug 1 hour before meals or 2 to 3 hours after meals. Client should not take with antacid or milk or iron. They should note the expiry date on this medication because outdated tetracycline can break down into a toxic byproduct. So you want to be conscious of that. Monitor renal function as the drug can be nephrotoxic. And because of this severe hyposensitivity, the client should avoid sunlight. But if they need to still go out, then they need to wear long sleeves, wear a hat, wear a sunscreen. And again, you must rule out pregnancy if prescribed for female clients of childbearing age. I repeat, you must rule out pregnancy if you're going to prescribe tetracycline for a female client of childbearing age, and do not administer to children under the age of 8 because of the discoloration and inadequate calcification of their primary teeth.